I was sitting in a doctor's office this week, and I noticed there was a fall prevention poster on the wall. And I took a look at it, and it's the standard list. You know, remove the rugs, light the way, make sure you check your medications, or you talk to your doctor about your medications and how they could be involved with a fall or somehow make you lightheaded and increase your risk for falling. And then I got on social media and looked through a couple of local publications, and I saw several companies that were touting themselves as fall prevention companies. And look, there's 10,000 Americans turning 65 every day. There's more than enough people that we need to address. I mean, the 85 and older population is the fastest growing population in the United States of America right now. And what I noticed is that they give a list, these companies, they're given a list, and that's it. Some will refer to you to Tai Chi, some will encourage you to go to physical therapy, which are both great things. But as we've talked about earlier, research shows that balance-specific exercises are much more likely to help you improve your balance. It's been proven. And then I came across this study, and I started looking at why aren't our statistics changing? And that study about the balance-specific program, balance-specific exercises just kept ringing in my head. I just kept coming back to that. Tai Chi is great. Tai Chi is wonderful, physical therapy. But the thing about that is, guys, is that are they balance-specific exercises? Not quite like Balance University. So looking at this study, over the past 20 years, gerontology researchers, spearheaded by Mary Tanetti of Yale University, I hope I said that right, have carried out a significant amount of research to address the problem of falls and injuries in the community. However, ubiquitous use of successful interventions is not yet in place in the community. This is what Balance University is trying to do, right? We're trying to get in the community. We have a new class starting today. Today's Monday the 15th. Holly Bruzina is doing a Balance University class at Stero Parks and Recreation Center every Monday, 11 to noon. It's a nice little plug for Holly. So, as healthcare moves toward patient-centered care, and as growing body of research provides guidance for widespread fall prevention programs, fall and fall-related injury prevention now has the potential to be addressed across the care continuum. We're not done. Inpatient fall prevention, right? So if you go to the hospital or you have surgery and you have to go to physical therapy anytime you're inpatient, right? Fall prevention has been an individual area of concern for nursing for almost 50 years. Traditional hospital-based incident reports deem all inpatient falls to be avoidable and therefore classified as adverse events. So listen, we can go through the statistics. We can talk about the different costs. I mean, if we're talking about 10,000 Americans turning 65 every day, with 30% of adults that are 65 and older experiencing falls annually, the cost of such accidents are estimated at $50 billion a year. Do you know who bears 2/3 of those costs? Medicare. So we should have a little bit more of a sense of urgency to do something about this, not just for yourself, but for our community as a whole, right? So, of course, insurance covers about $1,800 to $1,900 per calendar year. Physical therapy is great, but after you leave physical therapy, they give you a sheet of paper, you go home, and it sits on your counter, and you don't pick it up again, most people. Balance University is constantly evolving. Our classes are constantly changing. They're constantly evolving with your balance. As your balance improves, the exercises get harder. So let's do something about this. Let's change these statistics.